Hi guys, this is Mihal with the Rampa Coaching. Today we are going over a hip joint. A lot of people say I have a stiff hips, and sometimes I wonder what do they mean by that. So without really assessment, it's hard to tell which part of your hip is stiff and how to approach it. So today I'll show you very simple, easy techniques where you can first self-assess your hip mobility, hip range of motion. After that, I will show you techniques where you can roll the tissue around your hips, which is going to create more range of motion, and some lengthening techniques following. Let's start from a hip flexors, where they are definitely a big part of limiting the range of motion if they get tight. You can guess easily why our hip flexors get tight. By the way, hip flexors are the muscles that flex our hip. They're responsible for that. So they get tight since, in average, we sit 13 hours here in the US a day, which puts the hip flexors in a very short and tight position, and that contributes to creating a lot of tension here and eventually affecting the hip joint. So how do I know which hip flexors are tight? And you don't have to know the names of the hip flexors. That's really not the point of this channel. I said it's going to be simple. I would just like to know, based on the assessment I'm going to show you here, how to approach it depending on the results of the assessment. So this is very common assessment. A lot of professionals do it, just seeing which hip flexors are affecting the hip mobility. So you can just do it on a box or table or any kind of elevated surface where you just lay down on your back. I'm going to show it first from the side. Right at the edge of the box or table. From there, we're going to bring in the knee as close to your chest as you can. So we make sure that there's no arch in the back of whatsoever. So right there, you can see just relaxing the leg over here, and that will be the determining factor if your hip flexors are tight. So I can show you some options here. So first, you see a lot of people where the leg is going to just hang like this. So it's going to be kind of extended or close to extended. That's definitely an indicator that there's a lot of tension here because we don't have the ability to drop the leg down. So here we know already we have to address all this tissue around here. Second scenario will be leg is elevated like this. So when I bring it, my leg don't even drop down like that. It's just hanging up here. Those are the deeper hip flexors that come from your lower back. Very common, by the way, and very common problem with the lower back pain. So that will mean that we have to address the deep hip flexors. So that looks from the side. A lot of times the leg also migrates outside, so it goes out. So I'm going to show it from this angle here. Again, very important, bringing that knee very close to your chest, and from there we're observing the leg. So again, this is considered healthy. My leg is dropped, high, extended, needs work, or anywhere close here. And very often you see the leg kind of move out. So you can ask somebody to watch your leg or record yourself on a phone, and you can have a good picture of what is going on with your major hip flexors. Alright guys, now this is even easier way to assess your hip. Simple, just laying down on the back. This is also actually an exercise to work later on your hip range of motion. So not only you can use it as an assessment, but also later on as an exercise to fix your hips. So from here, we're going to again bring the leg in and drive your hips up. What I'm looking for is a straight line from my knee, hip to the shoulder. So a lot of times I see people can go only as far as here. So again, that's a pretty simple way of me telling that there's definitely some range of motion that we need to work on and to get that full hip extension. Alright guys, now we're going to go to assessment number 3. This is going to look into more of the hamstrings and how you fire your core. So from there, first we got to make sure that we sit. It could be a door frame right over here, so you can be in the middle of your door. the distance is the most important thing. So if I will measure distance from my knee to my hip, I'm trying to make sure that the door frame or the corner of the wall is right around the half of my thigh. From there, I'm just going to relax and lay down on my back. All the time, make sure you're pointing your toes up to the ceiling. So this is very important, that at any time your feet are not going to turn out. Try to be honest with this, because a lot of people, as they start raising the leg, the foot start turning out, which I will call, that's where I'm going to stop the measuring of the range of motion, because that means you start already compensating. So what I'm looking for is clearing the door frame or the wall. So if you can do this, again, that looks pretty good. That means you don't have to worry about that much. If you end up somewhere around here or here, again, it doesn't make you a bad person. It's just a good indicator that we have to work on your hip. So again, really focus on where are my feet pointing, keeping my knees nice and straight. So you see I'm really locking on my hips. So make sure you just don't bounce your leg like this. So trying to use some momentum. Again, we're missing the whole point of assessment. So again, pointing that toe up, very slowly raising my leg and trying to see, can I clear the door or the corner or not. Now we know if our hips are restricted, if they need some work. These are foam rollers. Now you can find them everywhere in pretty much every fitness facility, physical therapy office will have one of those. They come with a different density, so it's pretty much, they fall in the category of self-myofascial release, so you're pretty much massaging yourself. Some people call it a poor man masseuse. So if you cannot afford to have a masseuse on a daily basis, probably that would be a good investment. As we went over an ankle, this is pretty simple. We just want to roll the tissue that we just, on the assessment, notice needs some lengthening and more releasing of the tension. So let's start from the front of the thigh. I will put the foam roller on right in front of my right leg. So as you can see, I'm here. I'm getting to a kind of like an elbow plank. I'm supporting myself here with the leg on the side, and I'm just starting to roll front of my thigh. You can break it into two sections. First, the upper part, you're probably going to find a lot of tension here, or when you turn out a little bit, that's where one of the hip flexors gets tight. And once you roll the first part, you can move on to closer to your knee. Make sure you not roll over your knee. First of all, it's not going to provide any good results. Quite probably the opposite, it might cause a pain. So stay away from your knee right above. Make sure you're breathing while you're rolling on the foam roller. So I'm inhaling, exhaling, keeping my shoulder down, away from my ears, core engaged, so I'm not arching in my back, and just trying to find some tight spots. Let's say if I find a tight spot, and this is for the ones of you who are really brave, you can start creating some motion like that. So I'm bending my knee and extending. Just want to give you some heads up. This is going to be pretty intense. So if you ever have like a deep tissue massage, you might find a very similar experience here. So that's as far as the front. A lot of time I'm asked like, how long do I do it? I always say, just like with the massage, if you go to a massage and you have a 1 minute massage, it's probably not going to give you the same results as a half an hour massage. So whatever time you have, try to spend as much as you can. It's kind of hard to overdo it. You can't really overroll your legs, not that at least I know about. There might be some studies coming out on that. But that would be the front of the thigh. As far as the back of a thigh, there's a little bit of a there are different opinions on that part. A lot of experts say do not roll or release that tension. I actually play with it quite a lot with myself and trying to see if it produce any results with my clients. And I found that actually it would have to be definitely something more aggressive foam roller like this will not really roll much, so you're not going to gain more range of motion when you go back, revisit the one-legged race. So it has to be something more like this. This is actually one of my favorite tools. I also use it for the hip flexors, so you can do the same thing I was just doing with the foam roller. The reason why I like it is very portable, so you can always carry it with you when you travel. You can take it with you. You can keep it at home, doesn't take that much space. And pretty much for the lower, for the leg, it's really amazing. So, so the next part will be rolling the back here. So all I'm trying to do, just trying to roll. Again, try to pay attention on not only where I place the ball, but also in my shoulder position, where my hands are pointing. So make sure you're not like that. So we opening up the chest, keep a nice long spine, and I'm trying to again find some. A lot of times I notice more on the outside here. I can actually feel right there a lot of tension. So again, spend some good amount of time. Sometimes rolling in more, so you can even put the ball inner here. A lot of inner thighs over here carry a lot of tension. For the inner thighs, you can also, let me show you the roller. You can place the leg like this. Again, I'm here in the plank kind of position. My hip is actually resting here, and I'm just rolling out and in. A lot of people have accumulate a lot of tension here, right above the knee. You can go all the way to your groin, come back. That also is going to help a lot. And when you find an area with a lot of tension, just spend some time there. So it's pretty straightforward. If I find something right there, I'm just going to kind of camp here and spend a good amount of time focusing on breathing, just trying to relax. Again, try not to get very tense where you kind of protecting the body. Try to focus on breathing, relaxing, and moving along as you roll. Another very important part when it comes to mobilizing a hip is a lot of muscle here at that area, kind of like gluteal complex. There are also deeper muscle, hip external rotators. So we want to definitely spend some time with those. There's a couple of approaches for that. One will be just sitting on the top of the roller. Again, I'm placing my hands back here. I'm anchoring my ankle over my knee. So let me show you from this angle. Sitting down on the top of the foam roller, placing ankle on my knee, tilting a little bit to the right side so that the leg that is up. And again, I'm trying to find some tight spots. Again, for this actually part of the body, I really like to use that ball. It might be a little hard for some people to get into that position. So this is really more, I would say, advanced, but in the same time also gets deeper, since the hip is kind of like a cavity here. So this ball really kind of address a lot of those little muscles inside there. So I like to just spend some time there. Some people, due to different reasons, they can get in this position. So I will show you alternative. This is very easy. All you just need is a ball. It can be tennis ball, baseball. I'm just going to use baseball to give you an example. So what we're doing here, we're going to place the ball first under that hip area. And again, I'm just trying to find some tight spots by positioning the ball in different places. Let's say I found something right here. I can just camp here and just kind of relax again, and the body will sink into that ball, and actually that feels really good. Another way would be also crossing the leg like this. This is allowing me to access more of that tissue there deep, so I can just again camp here, maybe grab a book and just relax. Now we're going to